So this short video is a part of multiple short videos on the topic of optimizing health at every age. So if you are in the age range of 30 to 39, then this video is for you. But if you're outside of that age range, then look for your age category and watch that video. So basically the pillars are the same. So there are 4 pillars to optimize health at any age, and that is diet, exercise, stress management, both from internal sources as well as external sources, and then there is sleep management. So when it comes to diet in the age category of 30 to 39, then we need to make sure that diet is extremely healthy. It can be personalized, and usually we do that with the help of food sensitivity testing. We can also do additional tests to make sure that your diet is whatever your body needs. Typically at this age, the skeletal system or the musculoskeletal system is fully developed, brain is developed, so a whole foods plant-based diet is highly recommended because that gives you the most benefit and also gives you lots of nutrients that are needed to continue to stay healthy. In addition, there are cardiometabolic diets, there is a rainbow diet, there is a longevity diet. There's all kinds of additional diet plans that are posted on my site, so you can go ahead and feel free to look at all of them, look at the page comparing all different diets, and look at whatever works for you the best. The next thing would be exercise. So again, this is an age group where you're still healthy and the skeletal function or the muscular function hasn't started to decline yet. So a combination of cardio, flexibility exercises like yoga, meditation, deep breathing to keep the lungs healthy, strength training, core strength training, all of those are extremely important, and a minimum of 150 minutes per week is needed, and if it's more, that's even better. Then there is stress management. So stress is from internal sources and external sources. So the internal stress is extremely important because there is all kinds of metabolic activities happening, there is wear and tear happening, and it puts a lot of stress on the body. So what do? We can do testing on all different at all different levels. So we can do metabolic testing. So in this age group, the most common metabolic problems would be pre-diabetes and maybe diabetes at the same time. Then there is metabolic syndrome, there is obesity, there is non-alcoholic fatty liver disease, and then there may be markers of inflammation like C-reactive protein. So all of those should be tested if there is any hint or if there is any suspicion. Then there is nutrition testing. So nutritional testing involves a lot of different things, including amino acid panel, minerals, vitamins, antioxidants. But that big test or the entire test is not necessarily needed for everybody. If there is indications for any deficiencies, that can be done. The most common nutritional deficiency in this age group and across the board for everybody is vitamin D. So that must be tested and corrected. Thing would be hormone testing. So thyroid hormone abnormality is one that is extremely common. About 15 to 20% of the population has it, and this is the age range where it classically manifests itself. So we need to make sure that even if there is a small suspicion for this problem, we test for it. Then there are female hormones and male hormones. So women typically have progression of their hormone imbalance if they're already predisposed. So for example, if somebody was predisposed to polycystic ovary syndrome or endometriosis or other things, then they are going to have more aggressive form or more profound symptoms of all of these abnormalities. So if they were not tested before, and if we have any suspicion, then we should definitely check the estrogen, progesterone, and the testosterone levels, and the DHEA levels. And men in this age group can start to show symptoms of low testosterone. So there is going to be a small percentage of men who have low androgen levels, and as a result of that, they have symptoms. So we should check and, of course, correct. Then the next thing would be cardiovascular testing. So the most common cardiovascular problem in this age range would be high blood pressure that starts to kind of pop up and show, and high cholesterol and sometimes homocysteine levels. So we need to make sure that we check those levels and treat accordingly. And then the next thing would be a huge category of diseases, which is autoimmune diseases. So people who are predisposed to autoimmune diseases, generally they have a genetic makeup built for it, and the genes are sleeping up until this age. And in their 30s, maybe late 30s and early 40s, now they have enough accumulation of the stress on the body where the genes start to express themselves. So they start to show symptoms of autoimmune conditions if they were predisposed to those. So those are lupus, rheumatoid arthritis, and a variety of other autoimmune diseases which had been silent so far. There is more than 100 different autoimmune diseases, so people can start to show symptoms of those. So if we suspect anything on clinical grounds, we should definitely do autoimmune testing. The most common symptom is chronic fatigue. And then, of course, we can check other markers like markers of inflammation and chronic infection markers as well. The next thing would be stress from external sources. So that is basically your work stress. Usually people in this age group are doing some type of work. So they have a meaningful job, or they are even in school. But we forget in the process of working day in and day out that work in itself can put a lot of stress on our bodies and compromise our health. So what are the high risk works? Well, this is going to be your desk jobs where we're sitting in one place all day, or jobs where we are doing a lot of repetitive physical work, and hence we're causing a lot of wear and tear. Then jobs where we are exposed to toxins all the time, for example, factory and farmer workers, dental hygienists, and other people. Then there are jobs where we have night shifts, for example, healthcare workers, where circadian rhythm is all jeopardized. Then there work that involves potential conflict, for example, with other people, and this would be jobs that are in human resources area and even the customer service area. So although it may seem like this is no big deal, but all of those types of work can cause significant amount of physical and mental and even emotional stress on the body, and in the long run can cause a lot of problem with the quality of life. So we need to make sure that we manage external stress as well. Then the next thing would be sleep. So a good quality, not just the quantity, but the quality of sleep is extremely important. So a 6 to 8 hours of sleep is needed. And this is the age group where people have young children and they are most of the time not getting sufficient sleep. So we need to make sure that we make sleep a priority so that we can restore our bodies and function properly. You can check out my sleep page where there is all kinds of information on sleep disorders and management strategies. The next thing would be, and the last thing would be, genetic testing. So although genetic testing is not typically done, but if there is any suspicion, we can definitely check for genes that are going to predispose us to, even if they haven't fully expressed themselves yet, that are going to predispose us to future problems. For example, genes that put us at risk for cancer. Then there are genes that basically tell us that we are at risk for future autoimmune diseases, and the genes that are related to our metabolism. So all of that genetic testing can be done based upon individualized and personalized needs. So this is just a few things that we can do to optimize health and stay as healthy as much as possible for as long as possible. Thank you.